we heard a lot of things about sleepwalking. However, what is the clinical significance? What's the clinical implication of sleepwalking? So in this study, we for the first time to find people with sleepwalking, they have high risk of neurodegenerative related mortality. My name is Yang Gao, currently distinguished professor at Fudan University School of Public Health.
Hi everyone, I'm Xingyuan Cindy Jiang, and I gained my PhD in nutritional sciences at the Pennsylvania State University, and I'm currently a postdoctoral fellow at the Harvard Medical School and Brigham Women's Hospital.
The title of our paper is Probable Parasomnia and Mortality, a prospective study in U.S. men. It will be published in October issue of Mayo Clinical Proceedings. So in this study, we included around 26,000 old men. The average age was around 75 years old as a baseline. During 6 years of follow-up, we found people with probable parasomnia, including probable sleepwalking and probable REM sleep behavior disorder. They have higher risk of mortality in the future. The association particularly stronger for neurodegenerative disease-related mortality. So for people with 2 parasomnia symptoms, the risk of neurodegenerative related mortality increased by around 5 times relative to people without this kind of symptom. When we separate these 2 parasomnia and do data analysis, we also found the significant association between probable sleepwalking and total mortality, and also the strong association between sleepwalking and RBD with neurodegenerative related mortality.
In this study, we looked at probable parasomnia and mortality. Parasomnia represent the abnormal behavior that arise during sleep in either the REM stage or the non-REM sleep stage. So the REM sleep behavior disorder, or RBD, is a problematic enactment of dreams involving the loss of normal muscle atonia, whereas sleepwalking is a major manifestation of the non-REM sleep behavior disorder, usually manifested as the walking while you're sleeping, and that mostly occurs during the slow wave sleep phase. So our study find that the a positive association, a higher risk of mortality among those with probable parasomnias. And these are in line with the few literature previous studies that suggest that probable parasomnia associated with cardiovascular risk factors and also neurodegenerative diseases, especially Parkinson's disease. So sleep is a multi-dimensional procedure, and we hope that future epidemiological studies as well as clinical studies would further address these association we observed in this prospective cohort study.
This study is the first prospective cohort study to examine the potential clinical implication of sleepwalking. And there are a lot of studies have been done for RBD, REM sleep behavior disorder, but we know very little about the clinical significance of sleepwalking. So in this study, we for the first time prospectively found probable sleepwalking could be a marker, prodromal symptom for neurodegenerative disease. It can predict future risk of neurodegenerative related mortality. However, because this is the first study, we need more study to replicate our finding.
So we welcome the readers of Mayo Clinic Proceedings to look at the October issue for this interesting paper. And we also welcome any audience that are interested in sleep, especially parasomnia, to conduct future studies based on our findings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.